And we start in KwaZulu-Natal, where medical staff at the Prince Mshiyeni Hospital are expected to hold a picket following the death of the late Dr Alulutho Mazwi, a medical intern at the hospital who died last week. Now, Dr Mazwi died after allegedly being forced to work by his supervisor, even though he reported that he was not well. His death has sparked outrage with healthcare unions, and the KwaZulu-Natal Health Department has placed the supervisor on precautionary suspension pending an internal investigation. But for more on the story, let's speak now to SABC News reporter Simphiwe Makhanya. Simphiwe, good morning. Of course, this story, also gaining quite a bit of traction on the social media platforms, even some of those messages between the late Dr Mazwi and his supervisor being shown there. But we see that the healthcare workers at the hospital intending to picket. Talk to us about the latest developments, please.
Absolutely, Sakina. A very tragic story indeed coming through from Prince Mshiyeni Memorial Hospital. And in fact, as you come to us, those members of the Public Servants Association have started gathering outside the Prince Mshiyeni Hospital for that picket, which is expected to get underway shortly. But of course, Sakina, that particular incident has sparked a lot of anger in the health, in the department in the province and also in the country, with the Minister of Health also issuing a statement condemning this particular incident and also calling for an investigation into exactly what may have led to this particular incident from happening. But of course, we do know that the Department of Health in KwaZulu-Natal has issued that statement to say that the supervisor in question has since been placed on precautionary suspension, as of course that particular investigation is expected to continue. But of course, Sakina, I'm not alone. I'm going to introduce someone who has been raising issues that have to do with the challenges at this particular hospital. That is Mr. Ndlovu. Mr. Ndlovu, thank you so much for your time. Of course, you've been here time and time again raising these particular concerns about the staff shortages, about the ill treatment of some of the healthcare workers here. Are you satisfied with the steps that have been taken by the Department of Health, placing this particular supervisor on precautionary suspension?
First, as PSA in the province, we are not happy with some of the measures that have been taken by the department, because there are rumors that the person that have been placed on precautionary suspension, she was seen inside the facilities. It is concerning, because if you have been placed on precautionary suspension, you will not be seen. So we appeal to the department to be able to investigate. Secondly, we are not saying the department must not investigate, but they can investigate themselves. That's why we have written to Ombuds to say, health Ombuds, to say they must investigate. We have also asked Employment and Labor Department to come and investigate, because if someone died in the hospital, there are processes that need to be followed in the terms of compensation fund. So it is for these matters we said enough is enough. We have dealt with most of the issues here. The department seemed to be lacking, and the view of members is that the province, in terms of the health system, it has collapsed. It's now the time for change, and it is the voice of the members that are saying we are tired.
What change are you referring to?
In terms of the change, we are saying there are 16 positions of medical officers that's supposed to supervise this intern that are not filled. There are 42 positions of professional nurses, and the CEOs, not only the CEO of this hospital and other CEO, head office of health, seem to be micromanaging. Even the CEO can't make the decision, because in our view is that if there's a questions of deficit that has been created by the provincial office, the institution must be allowed to be able to fill positions. The issues of the infrastructure. If you look at Prince Mshiyeni alone, it's a regional hospital with 18 clinics. It has over 800,000 population with surrounding, with only one regional hospital.
Mr. Ndlovu, thank you so much for your time.
Thank you so much.
Of course, there was Mr. Ndlovu, who speaks on behalf of PSA in the province, giving us a sense really of some of the issues that the union has been raising time and time again. Of course, I'm going to link to studio for now, but of course we are going to be continuing to be stationed here as we expect that particular picket to get underway, Sakina.
Oh, thanks so much, Simphiwe Makhanya, there at the Prince Mshiyeni Hospital for us in KZN.